Let's go to some health matters now, where health professionals in Nigeria have called for improved testing and diagnosis for diabetes disease in order to bridge the awareness gap in the country. Diabetes is said to be caused by underlying risk factors like obesity and unhealthy lifestyle, and can also be hereditary, passed by parents to their offspring. In celebration of the 2023 World Diabetes Day, there is an intense call for access to diabetes care globally, as News Central's Adegboye tells us more.
Diabetes occurs in humans as a result of too much glucose found in the blood when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. It is estimated that there are at least 11.2 million Nigerians, representing 6% of the population, living with diabetes. Just recently, many Nigerians got talking about the disease after popular Nollywood actor John Okafor, popularly known as Mr. Ibu, who had been diagnosed with diabetes, made an outcry on social media asking for help following reports that his leg may be amputated as his case grew even worse.
I have been down for so many weeks. All I'm hoping is your prayers and assistance. I've been in the hospital since as I speak to you. I'm still lying down in the hospital. The medical director of this hospital said the best solution is, in case his new idea didn't work, the best idea is to cut off my leg.
One of the popular myths associated with diabetes disease is excess intake of sugar. But Dr. Chinasa Amadi, a public health physician, debunked this, highlighting other risk factors of diabetes.
You may not take sugar, but have diabetes. And because it's also a saturated fat problem, a trans fat problem, and before it even becomes a sugar problem. So it's not just the consumption of leaking of sugar. It's more holistic than that. If your diet is rich in saturated fats, your diet is rich in trans fats, then you're at risk for type 2 diabetes.
According to statistics, Pakistan, French Polynesia, and Kuwait are the countries leading with diabetes globally, with the least in the African region. But the World Health Organization says the low numbers in Africa can be attributed to low testing and failure to correctly diagnose the disease.
Because you are Black, your chances of being diabetic are higher. So being Black is a risk factor for type 2 diabetes. So between a Black person and a white person, a Black person is higher at risk. Why? It's just studies have shown that Black people, African Americans, Hispanics, Latino are at higher risk than Caucasians.
November 14 is set aside annually to celebrate World Diabetes Day in response to growing concerns about the escalating health threat posed by diabetes. The date marks the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. Adegboye reporting for News Central.
Team lead News Central's Health Desk, Dr. Kelechi Okoro, joins me to discuss the World Diabetes Day. Dr. Okoro, thank you so much for your time.
Thank you so much for having me.
All right, now let's start off with the most common misconceptions about diabetes that you, of course, encounter, and how can you help dispel some of these misconceptions?
Okay, so we just encountered one, and that's the one Dr. Chinasa talked about, that taking too much sugar or sugar is the direct cause of diabetes. That's not true. It's one of the risk factors, taking added sugars as well as other processed food. They're just risk factors, not direct causes of diabetes. Also, there's another one that says that once you are obese or you are overweight, you must have diabetes. It is a contributing factor, it is a risk factor, but it is not certain that you would have diabetes for just being overweight. However, nobody should be overweight because it's a risk factor. Another one says that if you have someone in your family that has suffered from diabetes, you would definitely get diabetes. Like I said earlier, just the risk factor, a very high risk factor. So, but it doesn't mean that you would definitely get it. And the reverse, if If no one in your family has never had diabetes, then you can't have it. Same thing applies. It's just a risk factor. And then this other one that's very important, diabetes has a cure. Anybody who tells you that diabetes has a cure is lying to you and just wants your money or wants you to not live long and healthier. Diabetes has no cure. It is one of the chronic diseases that can only be managed to the point where it is not, disastrous to your health, or it is not deteriorating your health, or there are no complications. However, there is no cure for diabetes. All you have to do is manage with either lifestyle and diet modification, prevention, early detection, and also for some people, insulin therapy.
And let's talk about the level of awareness, particularly in this part of the world, where, of course, a lot of people might not be privy to, a disease like diabetes. In terms of awareness, do you think that it's really out there, right? And also, how can individuals modify their lifestyle to reduce the risk of developing this particular ailment?
Okay, so I think that the awareness is there, but in bits and pieces, right? People just know that there's something called blood sugar, high blood sugar. Some people even say high blood sugar. They will say, I have blood sugar. Everybody has some sugar in their blood, but when it's high, it's diabetes. So there's some sort of, awareness, but not enough, or, informed information or informed awareness about diabetes. And also, how do you think that people can, manage or prevent? That was your question. How to prevent diabetes? From the risk factors, you can derive how to prevent diabetes. For example, like I said earlier, overweight. So you have to watch your weight. You have to make sure that your weight is healthy. Exercise. These days, we have so much sedentary lifestyle. Some people will say, it's an imported disease. Our fathers or our ancestors never suffered from it. It's because they didn't have a sedentary lifestyle. These days, we have a lot of creatives. We have people in banks. We have people who just sit and do their activities or their work from home without so much movement. Even without that, a sedentary lifestyle is not healthy. You need to move. You need to have a healthy, exercise routine for yourself. Also, smoking, some lifestyle like smoking, eating of over-processed food, highly processed foods, like canned foods, preservatives, all these fancy foods, fast foods, foods that have so much added sugars to it, so much salt to eat, your foods and canned foods, fried foods, something that's very rampant in this country, fried food, deep fried foods. These are some diets that, put you at risk of having diabetes. And of course, like we said earlier, it's a familial illness. If someone in your family has it, then there's a likelihood, it's a risk factor. So, and for that, that's where, early testing and routine testing comes up. And I believe that in the course of the conversation, we will talk about that.
Now, let's talk about the barriers people face in accessing diabetes health care. And of course, also what initiatives or policies can help improve access, particularly for everyone affected.
Okay, for every illness, like I always say, education, right? There's poor education. That's one of the biggest barriers to accessing healthcare. Because if you do not even know about this disease or have ample awareness or educated about this disease, you would not seek care. So that's one of the barriers. And also early testing, early detection. Like I said, it's a chronic illness that if you detect early, can be managed. You don't even need to get to the point where you have to amputate. There are a lot of people living with diabetes, and because they have good health-seeking behaviors, they have modified their diets and lifestyle, they are living healthier and longer. So, and also another thing is financial constraints. Yes, you've been detected. Buying drugs very expensive. Now, a lot of, like JSK has pulled out of the market in Nigeria. The economy has gone haywire. People can't even afford basic drugs, how much more routine drugs, because when you have diabetes, alongside lifestyle modification, you're going to be on routine drugs. So financial constraints are one of the reasons why people cannot even access diabetic care. Another thing is health infrastructure, especially for those in the rural areas, those in the underserved areas. They want this care, but they can't access it for different reasons, different obvious reasons. And talking about policies and initiatives that can help, to reduce the burden of diabetes and improve access to diabetic care, I would say education again, and also community-based initiatives, support systems, education at the grassroots, both online and offline, still boils down to education, and also on the part of the government, subsidizing of medications. And also there's something that happened recently. There was a bill to task every carbonated drink, for every carbonated drink you take, there's a percentage that goes to funding diabetic care. So initiatives like that would help to fund the access to diabetic care for a lot of people who cannot afford it. Yeah.
Thank you so much for your time, Dr. Kelechi Okoro.
Thank you so much for having me. And remember, your health and your happiness is my major concern here.
Very important.
Yeah.